The last portion that we are going to see is about the lymph nodes. So lymph node, this forms a separate chapter or a separate system within the body, which is a lymphatic system. So commonly the lymphatic system gets affected, especially in a major way when the patient has developed a malignancy. The metastasis or the spread of the cancer is via hematogenous and lymphatic route, and mostly in the hematogenous it is a venous side the cancerous cells are being transported. Here again, the regional lymph nodes are also affected, or the sentinel lymph nodes are affected. That is why when a patient has cancer, the physician is now going to investigate whether the lymph nodes are affected. Accordingly, he can grade the type of cancer. So in order to identify it, the physician does a biopsy or excision of the affected lymph node. Say the patient has a breast cancer, then they are going to do a biopsy of the axillary lymph node. It can be a superficial biopsy or a deep biopsy. Sometimes if this has been really a malignant one, and where the physician has to do a complete removal of the axillary glands or the axillary lymph nodes, then they will have to do something called as a regional lymphadenectomy. So you will have to select a code whether it is cervical lymphadenectomy or an axillary lymphadenectomy or an inguinal lymphadenectomy. In order to understand whether the lymphatic vessels are affected, a diagnostic study is being performed, which is lymphangiography. Here they are going to inject a dye into the lymphatic vessels and see whether there are any abnormalities within the lymphatic system. So here, in order to find out this lymphangiography, sometimes they do an injection study where they might be injecting a dye or a contrast agent, or sometimes they might also give you a radioactive tracer where the affected lymph nodes, the uptake of this radioactive tracer will be much more when the lymph nodes are affected, and this is being detected by some devices called as GM counter. So we have separate codes for intra-operative identification of such affected lymph nodes. We have separate injection codes. You will have to figure out what is the type of dye that is being used, whether it is a radioactive dye or just a methylene blue dye. The last portion is splenectomy. Spleen is a lymphoid organ, right? It is a storehouse, and of course it is a graveyard of all the red blood cells, where the red blood cells get perished at the spleen. So when the patient is coming for a major splenic injury, they might do a splenectomy. Here you need to understand whether splenectomy is a primary procedure or is it done in addition to any other primary procedure. In such case, you will have to report the add-on code for splenectomy. With this, we have come to the end of this cardiovascular system. I understand it is a very heavy portion. My serious advice would be please attempt the cardiovascular portion in your CPC exam at last, because you should never take risks. Thank you. Wishing you all the best.